Hello and welcome. Ladies and gentlemen, this is Fruhan Landman from Key Wealth, and today I have the privilege of sharing Sirago corporate comprehensive gap cover for 2022 with you. I will be doing an in-detail video of this incredible product that has true value and is a must-have for every single person out there. So without further ado, let's dive in. You can ignore the premiums here. Every premium is rated individually per group. So the only thing that you can see is what the price of this product is compared to what you are actually paying, and that is the savings that your corporate company has negotiated for you. First things first. So gap cover settles what we call the gap cover, or they cover the gap. The gap is essentially where these products started. It is the difference between what doctors charge and what medical schemes pay. So if a medical scheme is a 100% plan, that means that they've negotiated to pay 100% of the fee that doctors charge in hospital. So to give you an example, say if you remove your appendix and the 100% fee for a surgeon is 6,000 Rand to do the procedure, that surgeon can by law charge 200%, or even 300%. They actually have the discretion to charge whatever they want, depending on how good they are, how long they've been in the industry, and all of those kind of things, which means this can effectively cost you 12,000 Rand or even 18,000 Rand if it's 200 or 300%. And the difference between what your medical scheme will pay and what the doctor charges is what we call the gap. And this 500% gap cover benefit is what would pay the difference here. So the medical scheme will pay 6,000 Rand, and your gap cover in this scenario would actually cover an additional 6 or even 12,000 Rand if the surgeon charged 300%. So that's a very nice benefit. You only use this when you go into hospital, so a person should kind of think of this as a booster. It's an ad hoc or enhancement to the hospital benefit that you have. Very few anesthetists or specialists these days charge less or 100% or less. They all charge way more than 100%, starting at about 200% at least for anesthetists. So that's a very important thing. And then the second thing is that this product will pay all co-payments. Now, there's a big discrepancy in the industry in terms of jargon and what products actually provide to what clients understand what products provide, and how doctors describe benefits, how product providers describe benefits, and how everything just doesn't make sense. So in the medical scheme industry, we've got several different terminology or terms for different things. The first one is we have what we call a shortfall or a short payment. So a short payment is the difference between what the medical scheme charges and what your gap cover pays. In other words, that's where we claim this 500 Rand under the gap cover benefit. Then we have what we call co-payments, and a co-payment is a compulsory or a voluntary co-payment set in by your scheme. And this is, to give you an example, Discovery has a co-payment if you have to go for in-hospital dentistry, or they've got a co-payment if you have to go for an MRI scan or a CT scan. Those co-payments are defined by your medical aid, and it's in the brochure. If you go to a doctor and you get a bill for something because they charged more than 100%, it's not a co-payment, it's a short payment by your medical aid or an overcharge by your doctor. So that's why these benefits are categorized a little bit different. So what's very nice about this product, ka-ching, it pays all of the co-payments set out by your medical scheme. Co-payments are then further divided into voluntary co-payments and compulsory co-payments. And I'm going to skip this portion of co-payments charged as a percentage. That is just if your medical scheme has co-payments, but it's percentage-wise, then they will only pay it up to 17,500 Rand. But our corporate clients don't have percentage co-payments on the medical schemes that we recommend for them. A penalty fee co-payment, and this is where it kind of becomes known as a voluntary co-payment, and this is 13,000 Rand that they would pay. Where we work with this is, should you elect to go to a different hospital, so we call that a DSP, a designated service provider. You go to a different hospital to what your medical aid recommends, and then there's a co-payment on that. So BestMed has this and Discovery has this, and you can claim that penalty fee back up to 13,000 Rand 3 times per year. So that's a wonderful benefit. I always recommend to my clients to rather use a network hospital plan because it's cheaper, quite a lot cheaper, and include a gap cover, and then you will pay more or less the same price in what it would have been to have a medical aid without a gap cover, and then you're covered way more comprehensively. Important with this benefit is that you do need the cash flow. This is not a rule by Sirago or the medical aids, but what does happen is once you get to the hospital will actually require you to pay this upfront, and you will claim that 13,000 Rand back either from the medical scheme if it was a PMB procedure, so PMBs are prescribed minimum benefits, I'll get to that in a second, or it is payable from your gap cover if it was not a PMB procedure. Then everything is claimed in full from day hospital. So that would be if you go in for day procedure. This is stuff like taking out tonsils as a day procedure, getting a vasectomy as a day procedure. Even some larger operations like cochlear implants is day procedure. So whether you go to a step-down facility or a day clinic or something like that, or a hospital, your gap cover will cover you in full, which is a wonderful benefit. And then here we can definitely pause a little bit. PMB cover. So PMBs stands for prescribed minimum benefit. By law, it is the minimum amount of cover that your medical scheme, in other words, Discovery or BestMed, will provide in terms with the law because you are a paying member of a medical scheme. So a lot of gap covers are cheaper, and that would be because they exclude PMB cover. With Sirago, they pay PMB cover on this option in full. Now, why is that important? All medical schemes have what they call designated service providers. We spoke about that just now, and we call them DSPs in short, designated service providers. And what that means is that if you want to get a heart operation, for example, you've got to go to a cardiologist. Every medical scheme has negotiated rates with certain specialists like cardiologists, and they will not pay above 100% for those specialists. If you go to the right designated service provider, the medical schemes have agreements with them, and they usually pay them in full. But if you don't go to the right one, even if it's a PMB, they'll only pay the bill up to 100%. Now, why do I mention this? It's important because the law says that all PMBs has to be covered in full, meaning the entire account. Even if the doctor charges 18,000 Rand for a PMB, the medical scheme has to settle the entire amount. And to protect themselves to misuse of benefits, they brought in designated service providers, and that's why they've got agreements with doctors. So if you go to a non-designated service provider, usually what would happen is that the medical scheme would pay their portion up to 100 or 200% depending on your plan, and the rest of that would be your responsibility to pay. But if you have a gap cover, you can rest assured that regardless of what happens, which hospital you go to, which doctor you use, you will always be covered either by the medical scheme or by your gap cover. And this is extremely important because it's easy to negotiate doctors and rates and things like that if you know about a procedure in advance. But if you're in a vehicle accident and you urgently need life-saving treatment, there's no time to find out whether the anesthetist or the specialist is on the DSP list for your medical scheme, and that can have massive implications on out-of-pocket expenses for you. So this alone is probably one of the most important reasons to have a gap cover, in my opinion, because this protects you and it gives you ease of mind so that you know that regardless of what happens or where you go, you're always covered. Then Sirago covers hospital account shortfalls. This is a very nice benefit. It's almost like a catch-all benefit. And one of the most common places where we use this is if you want to make use of a private room in a hospital, you can negotiate this with your medical scheme. They approve it, but they still only pay a general ward fee, and then the difference can be claimed up to 1,500 Rand on Sirago. So that is very, very nice. A great benefit here is a sub-limit enhancer. So all medical schemes negotiate for prosthesis. They negotiate set prices, and it's usually not the cheapest products, but it's also not the most expensive products. But what's nice is these prostheses, should you have to get some kind of joint replacement or stents or anything like that, you can claim up to 25,000 Rand 4 times a year per policy, and then you can get the best of the best, and you can know that if there's a shortfall, you can claim that from the gap cover. Also makes use for step-down facilities, so that's very nice. It's a great benefit once you're done with the serious procedures and they have to move you to a subacute facility where you can just rest a little bit. It's not a normal hospital. It is somewhere where there's usually not a theater where they can operate. It's just nurses that take care of you. So you do have cover for that. So that is very nice. And then the next benefit that is incredibly powerful, the emergency room benefit. So this is covered up to 12,000 Rand. It's very important to understand that on this benefit, everyone is covered up to 12,000 Rand if it's an accident or a trauma event. An accident or a trauma event, it's easy. I always talk about blood and bones. So if you go into the or to the emergency room because you broke a bone or you cut yourself or a dog bit you, it's very easy. If there's blood and bones, you know that you'll be covered up to 12,000 Rand on this benefit, regardless of whether your medical aid pays or not. So this is what we call a stated benefit. The next thing is that everything in the medical aid world works with what we call an ICD-10 code. And as long as your ICD-10 code starts with an S or a T, that means that it was an accident or trauma, and Sirago will pay out that claim. So beautiful benefit. Okay, so this is actually an enhancement for next year. For 2022, the illness benefit used to be only for children under the age of 8. And for 2022, they included a 2,000 Rand benefit for everyone older than 9 years old. So now you can go to the emergency room for an illness. This can be anything from asthma to severe diarrhea or a high infection count or anything where you receive treatment. It can be antibiotics, it can be a drip, it can be stitches, whatever it is. If it's not covered under the accident benefit, you've got cover under the illness benefit for 2,000 Rand. It is subject to the 12,000 overall limit, so keep that in mind. If you are the illness and trauma benefit is still for children under the age of 8, and regardless of whether your medical aid pays or does not pay, they will still have cover for illnesses. This is a great benefit for children under the ages of 8 because they can go for high fevers, diarrhea. For babies, especially if they're under the age of 2, something like high fevers and diarrhea is very dangerous. So that's very, very nice for them. The gap portion is also covered, so that is a fantastic benefit on this. If your medical scheme pays and the rates were charged over and above 100%, you know that that's covered as well. Then we have preventative care. It's also a very nice benefit where you can claim an enhancement for this for next year. You can claim in alternating years 500 Rand towards your normal things like pap smears and cholesterol tests and things like that. So most medical schemes do pap smear tests once every 24 months, and in an alternating year you can claim 500 Rand back from your gap cover for this, meaning you can go for a pap smear every year. Very important with this benefit is that pap smears and things like that, they refer to the pathology test, meaning that you will still pay for your GP consultation. out of your own pocket or from your medical aid. It also includes child immunization. So anything that's not covered, well, if it is covered by your medical aid, but in an alternating year where it's not covered, you've got a great benefit for that. The next fantastic benefit is if your medical aid has day-to-day cover, whether this is a savings account or scheme benefit, if you go to see a specialist and it's out of hospital and the specialist charges more than 100% what your medical scheme pay, or on some options 200%, you can claim 1,350 Rand back from your gap cover even if you weren't admitted to hospital. So this is very nice. With specialists, things like pediatricians, gynecologists, any type of specialist really, they charge above. If they charge above scheme rates, you've got a gap cover claim back on Sirago. So that's also very, very nice. The appliance benefit we very rarely use because most schemes pay for appliances in full, and this is only if they charge more on the scheme rate than what the medical scheme pays. Trauma counseling, it's a fantastic benefit if a person needs it, and we pray that you never do. In certain life-changing events, and you can see here it's not limited to this, but this is hijackings. It's if you've been diagnosed with a dread disease where you've got a bad life expectancy and things like that, you can claim up to 700 Rand a month for 3 consultations at a trauma counselor. So that's very nice. A primary care consultation benefit, what this is for all of your GPs, dentists, alternative therapists like physios, bios, and occupational therapists. If they charge above the 100% scheme rate, again, you can claim the difference back from your gap cover. Remember here, not the specialist visit or the primary care benefit is if your savings or day-to-day benefits are depleted. It's mainly for if they charge above scheme rate. So where we use this GP benefit very often is some GPs are open over the weekends or after hours, and then they would charge double rates, and then you can have a claim there with your gap cover. We are almost through with this, and I hope this has been very helpful for you guys. So large benefits that we have here, and these are expensive things, but it's absolutely beautiful to see them in action, is a cancer co-payment. With Discovery, you have a 20% co-payment on cancer once you reach the 200,000 Rand limit. That would be covered in full up to the benefit limit of 183,000 Rand on Sirago. And on BestMed, you've got the cancer booster, and this would be if you use biological drugs or any of those expensive drugs where you run out of a limit, then you can enhance it with this product, and that is also a wonderful benefit. For the ladies, a sad thing is that medical schemes will do mastectomies. They will also approve double mastectomies if that's necessary. But what they would do is they would usually do breast reconstruction on the cancerous breast and not the healthy breast, leaving you out of pocket to pay for the healthy breast yourself. With Sirago, they will give you 25,000 Rand so that you can get a breast reconstruction of the healthy breast. Important here is that plastic surgeons are only covered up to 300% on Sirago. So even if you've got a 500% gap cover, it is limited to 300% on them. Some of the nice ad hoc benefits on this product is things like gap cover premium waiver. If anything should happen to you, your gap cover would be free for 12 months for your loved ones that are left behind. Medical scheme premium waiver, if something should happen to you, your medical aid will be covered for 6-month period up to 5,000 Rand per month. There's also an initial cancer diagnosis. If you get diagnosed with cancer, that's a positive histology report. You've got 25,000 Rand that's paid up front to you, and that's just to ease the pain a little bit and help share the burden of the cost. There's also Sirago Baby. So should you fall pregnant, you can just let us know, and then we'll help you to register for it. It's very, very nice where Sirago sends you a goodie bag and some gifts and things like that. And then a new benefit for next year is Sirago will assist with Medicare if there are PMB claims that are being disputed. So They give assistance for that. There can be a fee to it depending on how large the claim is, but it's very nice that they provide cover for that, that you know that you can get detail, you can get assistance there as well. So I hope this has been a insightful video and that it will assist you to understand your gap cover policy better, and that this will add great value to you. Thank you. Feel free to share this video with your colleagues. Remember, this is specifically on corporate groups, so don't share it with your friends and family, but please like the video if you enjoyed it and if it was helpful. Looking forward to seeing you and chatting in the future.